Keita, many thanks for joining us.
Happy to be here with everyone. I'm happy to talk about mental health, particularly with this group, because I think that, people have this tendency to think that we solve mental health issues in brick and mortar hospital systems. And that's just not always the case. A lot of mental health issues manifest itself in the workplace. And this is where people spend the most significant amount of their time. So it sort of intuitively makes sense that the workplace is a key and essential place to sort of get after all things I think related to mental health. And so when we look at what's going on right now with the current situation, just like right out of the gate, talking about what's going on with COVID. Since the onset of COVID, and for, of course, full 12 months, there was an immediate, I know it's no surprise to anybody in this room, many of your companies have probably did it as well, so I don't even need to say it, this shift to remote work. And for some, that worked well. For others, perhaps not so much. And so this idea of people being socially isolated was a big concern to the field of mental health. Being disconnected, not feeling like they were necessarily part of a team because they perhaps couldn't adjust to a COVID environment. And then, of course, balancing all that we know to be true with parenting and multiple roles for childcare and caregiving, and sort of the chaos that can sometimes exist at home exasperated things. So this was kind of the early part of COVID. Fast forward now with COVID in the context of the field of mental health, we've had over 500,000 deaths across the nation. So if you just, and I'm talking just in, in the US, and if you look at the math on how that impacts people, we have thousands of people dealing with grief and loss, and also perpetuated anxiety and fear around their future. What does my future hold for me? Am I solid in my employment? Am I going to be able to meet the needs of my children and my family? Will my company be solid? So all of these fears and unknowns have resulted in increased visits to emergency departments. We've seen in the field the domestic violence hotline utilizations have drastically gone up. At the same time, we've seen reports to child abuse hotlines going down. And in part, we believe that's because people are not laying eyes on children, particularly mandated reporters, school teachers, camp counselors, and all of that may usually see children. Also, we've seen upticks to the suicide hotlines. We've seen upticks to calls of people asking for support. And when I say upticks, I mean there was one report that a hotline had an increase by 700%. And so the utilizations are just off the charts. And then we're seeing, I mentioned emergency departments, but in particular adolescents, increase in visits for adolescents for mental health reasons in the emergency departments. And I know many of you may be thinking, why is she talking about adolescents? Well, these are the adolescents that live and breathe in the families of employees that are likely hired by your companies. And so it is kind of an all family sort of approach, because if a mom or dad that's, working for any of you has a child that's been admitted to inpatient, the whole family system can sort of crash, and there will be implications to the workforce. And so that's sort of, I think, it's a no-brainer why it impacts folks. But before COVID, just to get after, so people know a little bit about like how prevalent is mental health, like how common is it? Is it something I should only be worried about in certain populations, or what? I just offer you, and I have some stuff on the slides here, and then just some other things I want to share. It's likely more prevalent than you realize. So 1 in 5 people in the workplace have a mental health condition. And when I say condition, likely the most common is depression. And I'll talk to you more about depression and kind of how to identify depression and what to do with depression. It's the most common mental health illness disease across the globe. And it accounts for the biggest, the biggest rate of disability. When people are filing for disability claims and have struggles with mental health, it's largely related to depression. So couple that and kind of the next, I think, sort of sister diagnosis around above and beyond depression has to do with post-traumatic stress disorder. I'm sure many of you may be familiar with this disorder, but this is just the idea of people being exposed to trauma, having a traumatic event and then re-experiencing that event, having a negative reaction, hyperarousal about that event, avoidance related to things that may trigger to that event. And the event is traumatic in the eyes of the beholder. So it's very unique and specific. I might get in a car accident and weather it okay, and someone else, it might be a traumatic event. So post-traumatic stress and what we call in the field lifetime prevalence rates for trauma are very, very high. Like 90 some odd percent of people have been through some sort of trauma. The question is, how have they weathered it? And that is very unique and distinct too, and we can talk more about that. Like, what makes some people go through trauma okay and others don't. My background has been around wartime trauma, but certainly I can talk with you about all sorts of trauma. So we have depression, we have post-traumatic stress disorder, and then also what I think is impacting, and you see a lot in the workplace, which I already mentioned, anxiety, increased anxiety, and I mean actual diagnosable anxiety, and then also sometimes panic. And then when you look at the rates of substance use disorder. So for those of you that are leading large national organizations, if you think in your company that you don't have people here and now today struggling with substance abuse disorder on your rolls, undiagnosed to you and not known, well, you're probably not accurate, because it just, when you run the math on how common and prevalent these issues are, they likely are in your company, on your rolls, perhaps functioning okay, but substance abuse disorder over time can become very chronic and impact the workforce. And I think I have a slide here next on like, what are some of the implications to the workforce? Let's see. Impact on, okay, here we go, mental health in the workplace. I want to go over actually what are some of the concrete implications. And many of you may already know this, but absenteeism, very chronic for people struggling with mental health disorders. They will avoid the structure and routine of work. But also, how many of you have heard of the term presenteeism, where people actually just have reduced productivity at work? So they're showing up, but they're just sort of there and not necessarily in the production line. Increased, I already mentioned, disability claims, but also injuries, illness. I heard our moderator talk about this in the opening comments. Absolutely, accidents happen. You know, I came up the system as a mental health clinician working with military, and these are things when we would do our after action reports to any and all safety incidents. I don't care if it was about airplanes or mishaps in an office building or across the board. You see, when you pull the thread, ties back to issues around mental health and wellness. Also, just grievances and complaints that can just suck up large amounts of leadership's time when you're talking about mismanaged and undiagnosed mental health issues, high rates of turnover, and just legal struggles, across the board. So the impact of mental health, there's a number of studies out there that have also even quantified it and put dollars to it when we're losing staff or we have high rates of turnover due to sort of not tending to the mental health of employees, if you will. So I want to tell you also a little bit about what the research tells us, just kind of a couple of studies, because there are a lot out there in the field. And largely they come from the field of occupational health and safety, this idea of workplace wellness. And there's been a number of public entities that have researched this to sort of offer recommendations to the field on how to improve the health and well-being of workers. And originally, when you pull the thread back to its earliest sort of research on this topic, it stems back to actually violence in the workplace, and this idea of a disgruntled employee that leaves and then comes to the home of a senior leader in some way, shape, or form and inflicts some sort of violence. And, we've seen this play out in the U.S. There's been a number of classic ones. I mean, people use colloquialisms and joke about somebody going postal or, because of some violence that happened in the postal system. But there was a tragedy in D.C. not that long ago whereby a fellow that owned a steel company was murdered, he, his wife, their child, by a disgruntled former employee. So people tend to pull the thread on those, and then it does advance the dialogue on research. And it's a bit of a double-edged sword for me, because as a clinician, what we know about mental health is people that have mental health struggles are generally not violent. Like largely, like when you pull the stats, like it's a very, very low number of people that are struggling with some sort of schizophrenia or something like that exhibit some sort of violence. But these are the things that kind of make the media and that sometimes are used to advance the field. So, I'm happy to talk to you guys more about that, but know that that's sort of where the research originated. And in one study, what we saw in terms of the research is just increased prevalence rates when they do survey work. So they'll just do large scale survey work of a good group, a large group of employees, and they'll find undiagnosed high rates of depression, PTSD, substance abuse. Also, those of you that are employing people between the ages of 20 and 30, like younger people, this is a particular high risk time frame that I would offer you is an opportunity to really zone in on your key demographics and know what's going on with your workforce in the context of mental health, because there is this sort of thing in the field, they call it like onset of mental health. Like, what is the age of onset, you'll hear them say. And 18 to 22 is a critical time period for age of onset for certain types of mental health disorders to appear. And that is often happening during college years or early employment. So I just say, like, run the math. What do you know about your staff? How many fall in that 20 to 30-year-old? And then there is also another key demographic I would recommend you zone in on. And that is, we call it in the field, they'll say that men in the middle years, or you'll see a title of an article, white men over 55. And this is really a demographic group that is at high risk for suicide. And, we've studied this in the field of suicide prevention for years and, sort of theorized about it. But this is that age-old, have I contributed enough to society? Am I doing what I should have done? Am I meeting the goals I should have met? And just men over the age of 55 that are struggling with that phenomenon, and also not being connected to strong social support. When you unpack mental health, what we call protective factors, or things that buffer against suicide, against mental health risk, the biggest buffer is social support, meaning having peers and others that you can rely on and debrief with and connect with. And we know as people in the field become very senior leaders, there's often less of that. And so I just offer to you the importance and the power of social support and peer support and connecting to others, critically important in the field. So the other thing to mention is, the field of mental health is also not perfect, just likely like many of your fields. And so when people do finally get in for help, we want them to get something that we call evidence-based practices, right? Well, that doesn't always happen. And we want them to get help right when they need it. And like, we do have a national access to care problem in the field of mental health. And you just sometimes if you need to get into mental health, you or I can't just make a call today and get in. It's not that easy. And so the system is complicated. And once they get in, there was a study that found, look, of those that finally got in and got treatment, they only got minimum treatment. And the sustained effects did not stay in place over a longer period of time, 3 months, 6 months, 9 months out. So maybe they got an initial relief, but the effects didn't stay in place. So I just tell you, even as a senior leader, this is kind of what I see companies very prone to doing. Oh, someone has a mental health issue. Let's get them to EAP and get them help. And it even, happened in the military, like the military commanders. Oh my goodness, so-and-so has a mental health problem. Get him over to the military treatment facility. And then it's kind of out of sight, out of mind. But really, that's not the way it goes, because they don't always get the help they need, and they still need follow-up. And by the way, after people leave care and treatment and insert themselves back into the workplace, they continue to be at risk, and they continue to need us, and they need support services, and it's still complicated. So they got, they went to a 28-day treatment program, all is well. Not so much. It's still high risk. So the last piece, or two last pieces I want to tell you about in terms of the research. One has to do with the age-old comorbidity, chicken, egg, what comes first. And this is the idea that people show up in hospital systems with physical health issues when in fact it's likely mental health. So backaches, headaches, if you have employees that are struggling with large amounts of physical health issues, there may probably be some sort of mental health. And what came first, who knows? Was it chronic depression over time that then spilled over into backaches, headaches, feet problems? I've heard it all, you name it. But just know that at the same time, the opposite can be true. People can have physical health problems, carrying heavy equipment, and now I have this, back injury that then leads to mental health issues. And the cost on the system for what we call chronic comorbidity, having, at least two or more struggles, physical and emotional, and it could be multiple: depression, substance abuse, and backache, this trifecta. the cost on the system is extraordinary for caring for that. And it's also probably similar to all of your fields. The longer you wait for them to get care, the more complex and costly it is. So that age-old, like, prevention focused, we called it in the military, left of boom, left of crisis, matters. The cost is less, the disease or the struggle is less severe, and you as a clinician, when they come in, you're able to get a handle around it and get them back in the fight quicker, smarter, faster, better than when they come in 2 years suffering chronic, marriage is dissolved, using, late on mortgages. I mean, just like the chaos abounds, right? So it's like, the earlier we get them in, the better. The last piece of kind of key gold nugget, if you will, from the research is just this study that looked at large-scale insurance claims analysis and pulled the thread and looked at the cost for treating workers, employees for comorbidity and substance abuse. It was 2 to 3 times as high for these patients compared to others. And so, for example, there was a high prevalence rate for people struggling with depression, asthma, and diabetes. So imagine over time how that impacts your bottom line as a business leader. Like, it does. I mean, if you think it doesn't, I mean, you're likely, not recognizing the broad, the scope of the problem. I mean, just like, it's either you get after it or it gets after you is kind of one way to look at it. When we look at prevalence rates for substance abuse disorder, just in generally, whether that's opioid addiction, which you should all know our nation has a opioid crisis if you don't already. Like 10 to 12% of Americans struggle with some sort of substance abuse disorder. That could be alcohol or opioids. And at the end of the day, the claims analysis study found that this like speed to market pressures for workers, coupled with the idea to rapidly deploy technology advances and having to balance work, family obligations, along with long commutes and feeling isolated, all of that compounded over time and impacted the workforce and their mental health. I cannot say enough about isolation and lack of belongingness as 2 huge risk factors when it comes to mental health. If you have employees on your team that feel marginalized or isolated, it is a big risk factor. And this idea of making sure that employees in some way, shape, or form feel part of the team, valued, and understand their role on the team and how they contribute to the mission serves as a buffer or protector against mental health risk. So there's actually like things you can do. So I want to go to my next slide and talk to you a little bit also about the costs. And I mean, I think you'll be surprised as me. I always double check these numbers before I talk about this, because I want to see, like, have they changed? Are things getting any better? And know that the annual global costs are estimated at 2.5 trillion. And that's cost across all sectors of the system: workplace absenteeism, hospital, like all sectors. And they have estimated that cost to go up to 6 trillion by the year 2030. So economists that that do this actuary work, where they run the numbers on predictive modeling on what is this going to cost the nation, have come up with those figures. And the leading cause, we already talked about it, depression. It's the leading cost for loss of work productivity, sick leave, and premature retirement, which how that then impacts your whole teams and your system. There is this idea that $1, and not just an idea, like economists have studied this out, $1 of investment in the field of wellness and mental health can result in a return of $4. So implementing a strategic wellness program in the workplace works. And, there's all sorts of resources and things I can help you with if you're trying to think through, like, how do I get started? What would a small wellness capability look like? What would it look like on year 2 or year 3? But it is important for employers like yourself to recognize signs and symptoms of depression. If at a minimum, you just wanted to get your head around, how do I recognize depression, PTSD, anxiety, and substance abuse? Just those 4, how do I recognize it, and what do I do about it in a proactive, prevention-focused way? That would be a win for this year. That would, get you to a better place. So I want to, above and beyond the dollars, talk about how to recognize it. And let me take us to the next slide here. In terms of just quick and easy ways, because I recognize that, all of you do not want to be therapists, or you would have become one. So I'm not trying to turn folks into mini clinicians, nor am I trying to turn your companies into the community social service agency. I get that you have a bottom dollar and that you must advance the goals of your company and all things. So know that I'm just trying to teach you the minimum way to get to your goal by sort of embracing all things mental health and wellness in a way that will help you. When you have employees, when you're thinking about depression, sort of the way that I teach this a lot is just a sort of quick cheater's way to remember is the 2 H's. If you have employees feeling hopeless and helpless, that's a trigger. That's a sign right there. But the thing is, you've got to teach your front managers how to identify hopelessness and helplessness. Like, they have to know those terms and know how to identify it. And so how do you do that? Like, if employees have difficulty concentrating, if they are no longer interested or excited in a piece of work that they previously would have just been nuts about, like if they feel, if you see that they are distant, sometimes the changes are subtle. They're very, very subtle, but you have to watch, especially during COVID on remote. Like, it's very difficult to identify social clues on virtual. So you really kind of have to train your employees to get savvy at that. If they're short-tempered, if they are having frequent mistakes and kind of negative emotional language, like there's just nothing I can do about it. If you have an employee that is always the yeah, but, hopefully you guys know that kind of employee kind, this yeah, but, it won't work, yeah, but, I can't do anything, it's impossible, over time, and that's not their normal personality, irritable, angry, all of these are, signs of mental health issues in the workplace. And I should mention also the importance of sleep. There are people that spend their entire careers studying sleep and how sleep impacts senior leaders and their decision making. It's probably another topic for another day, but how it plays out when employees are not getting sleep, especially if you have a workforce working shift work and nights. I myself saw this. I mean, there's entire clinicians that have their caseloads dedicated to night workers that struggle with sleep. And, I'll never forget, there's a sort of a classic suicide researcher in the field, Thomas Joyner, who talks about, in the absence of screening for suicide risk, if you screened for sleep, you would likely recognize people struggling for suicide. And it's just very, very powerful. So if there was something we could do to recognize whether our employees were getting even the minimum standard when it came to sleep, that would be in the good bucket. So moving on to the next slide, if we think about what can employers do, like what can my company do? I just offer to you, and it's probably not anything that any of you don't know already. This is about setting the right culture. This is, and of course, I know you probably hear this all the time. It starts at the top, and it starts at the top in the context of it being okay if you're not okay. Just let that settle in for a minute, right? That it's okay if you're not okay, and that I'm here for you, and that we'll figure it out together. And employers need to set that type of culture. And how you do that is multi-pronged, and it does take work and effort, but I offer to you, it's a pay me now or pay me later sort of analogy. So standing up a wellness committee and getting people involved and having the employees tell you what we should do when it comes to wellness. And these are largely no cost, no dollar amount sort of solutions it's in the grand scheme of things. But getting people involved and making them feel part of this wellness mission, critically important. It's not the idea of checking the box and sending them to EAP. I will tell you, there have been large-scale surveys that have evaluated people's, even pull your own data, how many people in the company use EAP. You will see that it is not the sort of solution, the one-and-done solution that you might think it is, but also training your people on signs of symptoms at risk, identifying ambassadors. You will see that there are people in the company that have what we call, as a term in the field, lived experience. Means like, they've been there, done that. You will find that there are people that have struggled with mental health and come over the other side and are willing to tell their story. And it is so powerful. So use those lived experience people to get in front of the group and talk about it. We did this a lot in the military. It's pretty powerful when a 2-star general stands up in front of an entire, 20,000 Marines at Camp Pendleton and is able to say, like, I struggle too. I re-experiencing the things that I saw downrange, just like every one of you. And, I've got help too. It's very, very powerful. So lived experience, talk with your employees about expectations of remote work. And I just offer that we have to be very, what is the word? We have to be very, I don't want to say blunt. We have to be very practical and upfront. I expect you to have your camera on. I expect you to show up on time. Like these sorts of things, like so that we can lay eyes on our people, so that we can make sure that we're providing them the care and the support they need. And there are things that coworkers can do. One of the biggest things for helping people around mental health, I already mentioned social support. So peer support, colleague to colleague, battle buddy to battle buddy, matching mentor to mentor kind of things. Those absolutely help. And the big thing in the field of mental health is really a focus on hope. There is hope that people can do better. There's hope that people can get the support they need and that they can be approachable as a colleague or a leader and say, I've noticed this. Are you okay? Can I help you with anything? Share what you see and offer what you'll do. That's like a quick and easy way to kind of figure out what to do. Create the culture in such a way that people are okay raising their hand and saying, I need help. Whether it's one-on-one or in a group or anything like that. I will offer you one little tidbit about the field of suicide prevention, just because, again, I've spent a large amount of time, and it is the 10th leading cause of death in the nation and the second leading cause of death for 14 to 24-year-olds and high rates of men over 55. We have to train our employees to get comfortable asking the question. When you know someone on your team is struggling, feeling marginalized, feeling like they don't belong, feeling like they can't cope with all of life's stressors, we must ask, are you thinking of ending your life by suicide? We can't be afraid to ask that question that directly. In the absence of asking that question and beating around, we will not know. And when one suicide happens, it will bring an entire company down. For one person on the team, 135 people are impacted. And, if I just tell you, 47,000 people across the U.S., and we could pull the thread more globally, big problem to kind of get our arms around if it hasn't happened yet. It could. So other signs: withdrawal, lack of engagement, choosing not to use the camera, missing deadlines, all things you're probably already aware of. I've been involved with companies that do everything from, pushing out a wellness email blast once a week, Wednesday wellness, to it's never one thing. Like I've had leaders ask me, Keita, what are the top 3 things we can do? What are the top 3 risks and what can I do? Like it's a 1-for-1 match. It just doesn't work that way. It's more of an all hands on deck, ingrained into the fabric of the organization. Whether it's, now virtual yoga coupled with the Wednesday blast, coupled with small group discussion, coupled with calls offline that are not part of a normal structured call and checking on each other. I mean, it's a lot, but I absolutely believe it's worth it. So let me ask all of you, just in the sake of being a little bit, I'm going to go to the next slide, hokey for a second. If folks are sitting there and have a pen and paper in front of you. Let me look here. Just to do like a quick exercise. I want to pull up this one list. Physical, emotional, social, and spiritual. If you were to think through just really quick in a minute or less, 2 things that you do in the physical space to take care of yourself, the emotional space, the social space, the spiritual space, this notion of biopsychosocial spiritual. Maybe you run, maybe I think someone's walking right now on a treadmill, I see. Maybe, you do yoga. Like, what are 2 things you do? Maybe you get up early and have a cup of tea before the kids wake up. What are 2 things you do? And just jot them down real quick. Do you have to is the first question in each one of those 4 areas. And if you don't, maybe that's a point of self-reflection for yourself. It begins with you in terms of wellness. And if spirituality is an area where maybe you're not overly, you don't have at least 2 things you're doing, know that it does not mean brick and mortar churches, but just the idea that you get in touch with some sense of spirituality. that you reach out to people socially, that you take care of your emotional health and wellness. When people see you doing it, they will do it. So I think that is, something for you to think about. And if not today, then at some point. So, in closing, and as we kind of shift towards any questions, I'm happy to talk about the field forever. So no issues. I just offer you that we've got to build a workplace culture that enhances health and well-being, and really builds protective factors and buffers around people. And this is part of safety, and it is part of a health hazard work environment conversation. And we must work proactively to design the programming. It can't be a, by the way, happenstance. Oh yeah, let's have family day. Quick, throw it together, and we'll focus on our emotional well-being for one day a year. It just it doesn't work that way. So it starts with engagement from the C-suite all the way to the frontline supervisor, and then it has to be sustained over time, like any strategy plan you would put in place for any other goal you want to meet. Thank you all for your time, and I wish everybody, good luck in the coming year as we roll into a post-COVID timeframe. Thank you, guys.
Yeah, great. Many thanks, Dr. Franklin. You take care.